name is Rebecca Williamson. I'm the publisher of FierceHealthcare, and I'm here today with Lynn Falconio, Chief Marketing Officer at Publicis Health, and Brendan Gallagher, Chief Connected Health Officer at Publicis Health. Thanks so much for joining me.
Thanks for having us.
Now, Lynn, I'm excited you're here. I think agencies represent a really unique part of the healthcare ecosystem. How do you see healthcare marketing fitting into the larger healthcare industry?
Thanks, Rebecca. That's such a great question, and we're obviously passionate about it as well. So much of what we're hearing here is all about patient centricity and patient engagement. When you think about it, at the root of that truly is some of the content that is developed, and the content that's developed in a way that's going to touch you, that's going to reach you, that's really going to motivate you to act or behave in some way. And that's really a big part of what Publicis Health does and the companies that are within Publicis Health. We actually believe that healthcare marketing is healthcare, because much of the work that we do is that work that starts the conversation. And we know that, good outcomes, positive outcomes generally always start with a healthy conversation. We say that healthy conversations lead to healthy behaviors, which lead ultimately to better outcomes.
That's great. I love that. So can you expand a little bit more on what you mean when you talk about engagement?
Sure. It's a tricky word, right?
Sure.
And everyone's kind of saying it, but it's really thinking about how do we define it. At the end of the day, it's what's required to really understand you, to be able to find you, know you, hear you, and reach you in a way that's really personal. Everyone's applying it to healthcare today because it's so important that the industry makes that move. But when you think about it, engagement is needed for any system, whether it's an educational system or a political system, and it's learning how to really tap into what those motivators are that is just so important to engage.
That's great. Now, Brendan, moving on to you. So much of the health conference is about the intersection of technology and healthcare. Mm-hmm. How do you see connected health and technology fitting into the idea of engagement?
Well, I think technology powers the engagement that Lynn was talking about, right? So at its core, we're at a pretty significant crossroads right now where we can actually live the patient centricity dream and not just kind of talk about it. So I think what Connected Health does is looks at technology, content, and data to help build better experiences that are actually connected into the way that people actually engage with their healthcare. So it used to be that each one of those disparate engagement points were all completely unconnected from one another. Sure. The patient would go to a place where health would happen to them and then go somewhere else, and that there was no connectivity between those two places. I think we're at a really cool spot in terms of the evolution of connected health technologies to enable those better experiences.
Okay, great. So I think we would all agree technology's changed the way we interact with the world, but we're also realizing there are some negative effects of that. We've got mental health issues, lifestyle issues, etc. How do you think we balance that sort of double-edged sword?
But it's like Homer Simpson said, it's technology, except he was referring to beer, is the cause of and solution to all life's little problems. But I do think we are becoming more aware of the role and the impact technology has had on our lives, as from a well-being standpoint. But I think we're at a really nice spot now where we could start being more aware of how technology impacts our health and using it for good.
So Lynn, to close out, if you have to sum up 3 key points healthcare marketers need to focus on, what do you think those would be?
3. We talk about a couple things at Publicis Health that we think are really important. So I would say one major fundamental shift, it may seem kind of simplistic, but it's this notion of moving away from direct to patient to direct for patient. And that's everything that we've kind of been talking about, really understanding who the patient is and what their lived journey is, and understanding how to reach them in the moments that are most meaningful for them. The other big shift that we see is just in how the consumer patient is engaging with their healthcare professional. Sure. So big changes there. The HCP today is mostly digitally native. They've grown up in a different environment. The profile of that HCP is very different. So we're seeing a big shift from what was once a very paternalistic relationship to one that's far more based in partnership. Consumers are walking in to their doctor's office more time than not, knowing what they have, fully informed with the information to really understand the questions to ask and what they might need. And then the last, I would say, but this is probably one of the most important, is what we call the total treatment effect. So it's this understanding that today we know, with all the data that we have, that it's not just about the medication any longer. It's about the medication, which typically will take you about this far, and everything else that needs to surround you to ensure that you are on your journey of total wellness and that you have everything that you need for optimal outcomes. And that's things like your social support, where you live, the advocacy groups that you're engaged with. So it's everything that sort of surrounds the medication and the services becoming increasingly important.
Yeah, that's very good. Well, I think that's all the time that we have, but thank you both for joining
you.
me. This was a great
That's good.
conversation.
Yeah, thanks.